Okay. And then share this screen here. Okay, can you all see the agenda?
Yeah, I can see it. It's small. I don't know if you want to do like one page at a time.
I know. This is a bigger monitor that I have it on, so let me just see if I can do the one page. Okay, and then zoom in. All right. So, welcome. I believe Amanda already volunteered to be our timekeeper for today. So thank you, Amanda, for doing that. Before we go through and do introductions, I just want to go through the agenda so you have an idea of what we are doing today. We will spend, I'll do a very quick board of directors update after we do some introductions. And then we will have a presentation by Malaika. I hope I'm saying your name correctly. And she is going to speak about the New Orleans Breastfeeding Center's Infant Ready program. I'm really excited to hear more about that. And then we will spend the last hour essentially of our meeting connecting the dots. And that's where you'll have the opportunity to share anything new that's going on in your world, in the breastfeeding world, in Maine, region, country, and anything else that might be something that we would all like to know about. And you also have the opportunity to share any challenges you're having in your work, anything that you would love some advice or some input, some guidance from all of these wonderful experts on the call. And then we'll wrap up at the end of the meeting. And over here, trying again to get familiar with the different windows, and we have two more people joining the meeting. Okay, so any questions about the agenda or about this meeting format? I hear someone, sounds like someone may have unmuted, but okay. Excellent. So we will spend the next few minutes going through and doing introductions. Again, if you've just joined us, please take a minute to rename yourself if you can, so you have your full name listed and your pronouns if you would like. So I will start with introductions, and then I think we'll essentially go down through the attendee list, which again, the way my screens are. There we go. Okay, so my name is Kara Kaikini. Happy to be here. My pronouns are she, her, and hers. And I'm the board president of the Maine State Breastfeeding Coalition. I am also the breastfeeding consultant for Maine's perinatal outreach program and a patient educator at Maine Medical Center, where I teach breastfeeding, prenatal breastfeeding classes and facilitate the weekly breastfeeding group. And I'm really happy to be here with you all today. So the next person I see on the participant list, I think I'm just going to have to go through and call on folks unless it is all in the same order for you as well. But Holly, would you like to take just a quick moment to say your name and if there's an organization you may be representing, a brief intro for you?
Sure. Well, my name is Holly Mielkars, RN IBCLC, as well as the Director of Education for Acceleron Medical Products. I just want to start out by saying I miss you all terribly up in Maine. For so many years, spent so much time up in Maine, and I wish you all well. And Kara, thank you so much for inviting me to this. There's a lot of changes going on, in this challenging and difficult world. So I want to make sure that I am still supporting you all from afar, especially when it comes to breast pumps, insurances. We've added a few products, and Kara, I think I'm going to have an opportunity to educate a little bit more at the end of the call, correct? Okay.
Yes, in that last hour, we can all share anything that we think other people might know.
Perfect. And so I know many of you, but some I don't. I also am the secretary. I'm on the board of directors for the New Hampshire Breastfeeding Task Force. I have just gotten reelected to be the secretary for the second term. So Carol, I understand this whole Zoom thing and attendance and everything, because we're doing all of our meetings virtual too here down here in New Hampshire. So anyway, that's about it. I am up in Maine a little bit. My son is a freshman at the University of New England this year, so been spending some time up in that neck of the woods, just picking him up, dropping him off, that sort of thing. So thanks, Karen.
Awesome. Thank you. And I think I'm actually going to change my mind in how we start this meeting and how we do introductions, because I'm really hopeful that you're all going to be here for the second half of the meeting. And that's the point when we're actually going to go down through the list and you have the opportunity to share whatever you'd like to share. And if you don't have anything to share besides your name and where you are from, then that is fine as well. But I think that's when we're really going to have the time to go through everyone. Right now, we only have a few minutes before we're going to be starting the presentation. So what you can do in the meantime, though, especially if you aren't able to stick around, is you can type in the chat box who you are, anything about you that we'd like to know, what if you're representing an organization or if you're here representing yourself as a birthing parent, then please do that in the chat box, okay? And then we'll have time to really hear from each of you after that, since we have such a great number of people here. Okay, and again, feel free to type any questions in the chat box as well, either to everyone or you can send a question to just me, or also to Amanda Powell, who can help with any questions that you are having during the meeting. All right. So I'm excited to hear from all of you. I apologize for the timing and that pivot, but I think in the interest of time and respecting Malaika's time as well, we'll do it that way. So next on the agenda is a board of directors update. And what we have to share now is that we have made some really great progress on our strategic plan. And we have worked together as a team. We have worked with a consultant, Carol, whose last name is escaping me at the moment. It's not Carol Martin. If anyone wants to. Carol Kelly, thank you. Carol Kelly's working on this. And then we also had a smaller group doing a little more wordsmithing, a little more in-depth formatting of a strategic plan. And Carol Kelly will be reviewing that. And then the board will be reviewing it again. And we will certainly have something exciting to share with you by our annual meeting in April, if not much sooner than that. So stay tuned. Some of you may have been anxious to see what we come up with, but that's really going to be our guiding document and our guiding force in all of the work that we do going forward, since you all know there's so much that can be done in a group like this, and we're excited to have something to focus our efforts. We also made some progress in planning our meetings for 2021, and so that was sent out, I believe, in the email to you, and it's also part of we'll actually go over it at the end of the meeting, what our plan is for 2021 for meetings right now. And then a few of us were able to attend the Maine Association of Nonprofits Board Roles and Responsibilities webinar. So if you're part of a nonprofit, then I highly recommend you check out the Maine Association of Nonprofits. They have some really wonderful resources. And for nonprofits like ours that are new and we're all still learning, many of us are on a board for the first time. It offered a lot of great information. And speaking of boards, if you're ever interested in being a part of the Maine State Breastfeeding Coalition Board of Directors, please reach out. And we will be putting a word out in the future when we know that we will have some openings coming up. We'll be putting a word out asking for applications like we have in the past as well. But know that you're always welcome to express interest and put in an application. So keep that in mind. And that is it from me. Is there anyone else on the coalition board that has anything you'd like to share that I may have missed or forgotten? Okay. And thank you, Nicole. I see you introduce yourself in the chat box. She's one of our board members. If others could do the same and just mention who you are and where you're from, that might also be nice for Malaika, who is presenting, and she might like to know where you are all from, what areas you might be representing. So if you can find that chat box and type that in, that would be wonderful. And I'm just allowing a couple of other people in from the waiting room. Any questions before we move on?
Could I just ask folks, please, to put their full name in? I'm Donna Ellis, the secretary, and it really helps me with the minutes and in terms of keeping everybody straight. So I see that there are several individuals who haven't put their last names in. If you would do that, please, I would appreciate it. Thank you.
And if you're having a hard time finding where to do that, at least type it into the chat box. That should hopefully be an easier spot to find where to type in, if you're able to type. I know some people are multitasking with some other kiddos or pets at home, or possibly even having to multitask with a little bit of work too, but hopefully we'll have your full attention for this presentation. And thank you for adding in your name and other info into the chat box. Okay, well, it is my pleasure to introduce Malaika Ludman from the New Orleans Breastfeeding Center. I am really excited. Excellent. You were able to see, you can share your screen. Really excited to hear from you. I met one of Malaika's colleagues at United States Breastfeeding Committee meeting several years ago, and they have these presentations during lunch, during these roundtable presentations, and I thought this is a really wonderful program. And I will also, after the presentation, we will be entering into our Connecting the Dots part of the meeting, and we can also share other local resources and anything that you know of in terms of infant, in terms of emergencies in Maine that we can help people get prepared for, because some emergencies in New Orleans might look a little different than emergencies in Maine, but actually not a ton in terms of what the needs are. So welcome, Malaika. I will allow you to introduce yourself in the most proper way.
Thank you so much. Thank you for inviting me to be a part of this call. I feel worlds away from you here in Louisiana, but I was telling Kara that my in-laws live in the town of St. George, so I've been going to Maine the last 6 summers, but this was my first summer that I could not make it because of COVID, so I do miss the August in Maine. So again, my name is Malaika Ludman. I am a birth doula. I'm a certified lactation counselor, and I have a background in public health. I'm also a mother of two. I have a 5-year-old who was breastfed for quite a while, and I have a 10-month-old baby girl. I am also the program coordinator for the Infant Ready program, which is a program of the New Orleans Breastfeeding Center that I'll tell you a little bit about today. Okay, and first, just to give you some background on the New Orleans Breastfeeding Center, we are the first freestanding breastfeeding clinic in the state, and the clinic was founded in 2017 by Nikki Hunter Greenaway, who Kara met, and Latona Giwa, and both are nurses and IBCLCs. And the mission of our clinic is to decrease maternal and infant morbidity and mortality in the state by increasing breastfeeding rates through evidence-based care. So we provide clinic visits for both mother and baby for a variety of infant feeding issues, but we also collaborate with community partners, and we offer classes on childbirth and postpartum care and breastfeeding. We have breastfeeding support circles throughout the state, and we also have quarterly continuing education opportunities for providers. So we kind of stick our hands everywhere and help. We're all about collaboration with community partners. So since our focus today is IYCFE, I'll just quickly talk about what it is and why it's important. And I'm sure you're familiar with this, so I won't take too much time on it. But IYCFE, which is Infant and Young Child Feeding in Emergencies, basically refers to supporting the nutritional needs of children from birth to 2 years in any emergency situation. And emergencies can look different. They can be personal or family crises like homelessness. They can be public health emergencies like disease outbreaks, acts of terror or violence, but also natural disasters or weather-related events, which is what we see commonly here. And the one thing that kind of binds all of these emergency situations is that they make it really difficult for people to meet basic needs, and they disrupt daily life. And so the risk for malnutrition and infection and death in infants and young children is really high in emergency situations. And infants and young children represent a really vulnerable subset of the population. And we know from research that babies that receive human milk have the highest chances of survival. They're receiving protection from infection and adequate nutrition when other foods aren't available. And IYCFE has 3 different components. Those are to support breastfeeding, but also to support non-breastfed infants and to support complementary feeding. And we know these things and they are well, researched in the literature, but current emergency infant feeding care in the United States isn't really working when you compare the US to other countries in the world. We still lack the basic tools and training to make sure that infant feeding during emergencies is safe. And emergency responders also, they don't receive training in supporting breastfeeding. And a lot of emergency kits lack basic supplies that are needed to safely feed a young child. So that's sort of where we step in. So I'll give some background on the beginnings of our Infant Ready program. In 2018, Latona and Nikki, our co-founders, were invited to participate in a weekend-long convening at MIT that was called Make the Breast Pump Not Suck. It was a hackathon. And it was here that the Infant Ready feeding kit was first conceived, the idea for the kit. And Latona and Nikki had both had experience working in shelter settings as nurses following disasters. And it occurred to them that they had never seen any physical supplies in shelters that would help promote breastfeeding or help enable families to practice safe infant feeding. So they thought to themselves, what are some tools that could be useful for this? So the New Orleans Breastfeeding Center received an award for this idea, and we expanded the concept and applied for funding and made it into a reality. So the Infant Ready program was officially launched in 2018, and it's a grant-funded program. And the mission is to improve infant, maternal, and community health during and after disasters. And the different components of our program fall under these different phases of emergency management. So in the preparedness phase, we offer training on IYCFE that's designed for emergency responders and lactation professionals. And we partner with lactation education resources to offer this online training. We also do community outreach to prepare and educate families on safe infant feeding options during disasters. In the response phase, we distribute emergency feeding kits and educational booklets. We also have an informational warm line for families that we extend to 24-hour service in times of emergency. And lastly, we're in an ongoing process of evaluation, sort of see what works and what doesn't, so that we're better prepared the next time. So this is a picture of our emergency feeding kit, and it contains what we consider some of the most essential tools for safe infant feeding in an emergency. For the first couple days until a family can access supported infrastructure. It's not meant to, sustain a family for weeks and weeks. And these are items that we think any facility or public health agency should have in stock in order to support families. So there's hand sanitizer and steriling wipes to promote good hygiene. We have disposable medicine cups for cup feeding. We've included breast milk storage bags, a small portable cooler bag, and disposable ice packs to safely store expressed breast milk. We threw a permanent marker in there so that caregivers can label the breast milk storage bags. There is a nursing cover in there so that parents feel privacy and security and comfort if they have to nurse in a crowded shelter situation. There is a reusable LED light in the event of a power outage. There's bottled water for hydration, but it can also be used to mix formula if needed, if there's no access to boiled water. There's an educational booklet in there with tips on safe feeding. And we've just this summer added the face mask in there for COVID prevention. And all of this fits into this water resistant bag that's easy to carry. And also I'll say that we intentionally left out any bottles or artificial nipples or pumps because international guidelines don't encourage the use of those in an emergency because access to clean water or electricity isn't guaranteed. So you want to make sure that babies are eating and feeding from safe vessels. So these are the educational booklets that we include in our kits, and they are low literacy. They have diverse representations of breastfeeding bodies and caregivers. And we just had the booklet translated into Spanish. So it's English and Spanish in one booklet. And, it contains essential teachings on safe infant feeding and in the emergency situation. So there's information in there about hand expression, cup feeding, safe storage of breast milk, safe formula preparation as some examples. So in these first 2 years of the Infant Ready program, we've received, it's a really small program, and we've just received some grant funding, and we've been able to donate kits to different organizations to kind of distribute in the community. But this recent experience with Hurricane Laura was actually our first time mounting an actual emergency response, and it's something that sort of fell into our laps, and we had to kind of invent as we went, but it was a really great learning experience. Hurricane Laura was a Category 4 hurricane that hit Southwest Louisiana in August of this year and caused a lot of damage. So one of the first things we did was partner with Birthmark Doula Collective. It's one of our community partners. And we launched a 24/7 parent-infant emergency hotline. The purpose of that was to provide infant feeding support to families that were affected across the state. And the warm line was staffed by doulas and lactation counselors. And we also collaborated with a local language justice collective that offered interpretation services on the hotline in case there were Spanish-speaking families that made calls. So we sent out the flyer to community partners, state hospital lists, the Louisiana Breastfeeding Coalition. And in total, over the course of about 4 weeks, we had supported 60 callers that had information on that had questions on infant feeding, where to get supplies. They wanted to know where to receive medical treatment or counseling. And it was a very, very successful and useful service. The state had been sending many of the Hurricane Laura evacuees to New Orleans to shelter in hotels for free. And this was run by the state through the Department of Child and Family Services. And so one day after the hurricane, there were over 3,000 evacuees here, sheltering across 3 hotels downtown. And then by day 4, there were over 9,000 evacuees staying across 30 hotels. It was insane. And the city of New Orleans had set up an evacuee resource center at the convention center downtown. And this was a place where evacuees could go and receive supplies and services. And it was a great daily service. And the New Orleans Breastfeeding Center participated in 2 ways. The first was that we helped to distribute certain supplies. A lot of people came evacuated with just the clothes on their back. So there was a huge need for baby clothing, adult clothing, diapers, wipes, menstrual products. So we made a community-wide call for donations. We collected a bunch of things and we helped distribute that. Another way we became involved was by performing feeding assessments, which again, as I mentioned earlier, this really fell into our laps, but we knew that nothing of this type had been done before. And hours after the storm had hit, we received a call from the state. And this was also days before WIC was activated. The state health department had asked us if we could distribute formula to evacuees. And we were a little confused because we had never signed any formal agreement that we would be designated as the entity, managing formula distribution. So that was the first gap we observed. We were like, why are they turning to this tiny business to perform this humongous task? So we told them that what we could do is perform these feeding assessments, because from the IYCFE literature, you see that, blanket distribution of formula is a huge violation. All families should be assessed first, and formula should only be distributed based on need, because you want to preserve breastfeeding in families where that's already occurring. So we said, okay, we'll do these feeding assessments. We found an assessment form that is in Save the Children's IYCFE toolkit. We adapted that. And it had just these basic questions. And so for families that were breastfeeding, we gave them infant ready kits to support them. We had a few in stock, but not very much. And for formula feeding families, we directed them to WIC services. So we ended up assessing 48 families in the first 4 days. We had hoped to continue, but our capacity and resources were very tight at the time. And interestingly, we found that the large majority of families that we served were feeding their babies formula. Only 10% of families were breastfeeding. And 3 of the formula feeding families that we spoke to had babies that were born preterm. And so that was a huge red flag that these families should not be receiving powdered formula. They should be getting liquid ready to feed. They should be, somebody should be checking if they need breastfeeding counseling. There were just so many questions. So we took note of all these things and provided as much support as we could. And so, we distributed our kits, we handed out hotline information. We did observe that families were being enrolled in WIC, which was great, but they weren't receiving any other supplies to ensure safe formula feeding. Nothing to clean and sanitize, feeding supplies, anything of that nature. And also it was unclear whether any families were receiving liquid ready to feed formula, and if they were, how that was determined. Because again, we were the only ones doing any type of formal assessment. And then 4 days after the hurricane hit, the resource center ran out of formula, and it took close to 2 days to restock. And this was a really critical point for us because, well, one, we had noted these very low rates of breastfeeding in the evacuee population. And so we felt like we needed to do more than just apply for more funding and make more infant ready kits, because that wasn't helping formula feeding families. And many members of the community had offered formula donations, but we also knew, like, technically that violates international guidelines too. You're not supposed to accept formula donations and just hand them out haphazardly. So we sought, we sought advice and did a little bit of research. And in the end, we decided, okay, well, it's better to do more good than harm in this situation. Babies need to eat. And we knew that from the literature, okay, if at least we can supply formula, we need to also supply the other things needed to ensure safe formula feeding. So we wanted to make sure these families were assessed, that they received breastfeeding counseling if needed, and that they would get all the supplies to feed safely, that they would only receive liquid ready to feed formula, and that they would be enrolled in WIC or a similar program so that we could ensure they were getting a steady supply for as long as they needed. So we did some research and we received emergency funding, and we purchased supplies for what we called our safer formula feeding kits. And our goal was to meet the needs of this evacuee population. So we wanted to give out liquid ready to feed formula along with the necessary education and supplies. And then we referred families to WIC for longer term support. So the kit comes with a 2-gallon bucket, and that can be used to wash supplies in if there's clean water. There are also 2-ounce bottles of liquid ready to feed formula to last about 48 hours or so. Liquid dish soap to clean any feeding instruments, a bottle brush as well to clean feeding supplies, a mesh bag to hang dry any feeding supplies to kind of prevent contact with a lot of different surfaces. There's a bottle of hand sanitizer, medicine cups for cup feeding. There are, I think, 2 or 3 face masks for COVID prevention, and the infant ready educational booklet. So we didn't have a direct system for follow-up, but again, we referred families to the hotline and several other infant feeding resources that are included in our booklet. And it took a few weeks before we were able to roll these out, but in October, there were still many evacuees here, and there was another hurricane that had hit. So we were able to conduct more feeding assessments and distribute more kits and bucket kits as well. And by this time, there was a lot less traffic at the resource center, but we were still able to serve a number of families. I do want to point out that these pictures are huge WHO code violations because there's formula on the tables. They're branded and labeled. None of that should be happening in an emergency situation, but we clearly were working in less than ideal circumstances. So since August 26th, we were able to provide infant feeding support to 150 families that needed additional support beyond what was provided by the city and the state. And we were able to distribute donations to a couple hundred families. And so through this experience, we observed—
Can I interrupt for 1 second?
Yes.
It sounds like there's some papers that are rustling near your microphone on your laptop. So just
Okay, I hope that hasn't been muffling my voice the whole time.
no, we can hear you just fine, but just
Okay.
to give you a heads up.
Okay, thank you so much. We had observed that there was no intake or documentation of families with children under 2. So there was no way to contact these families, no way to quantify resources needed. Another gap was that there was no agency designated to manage and procure formula in the early days of the emergency. Another was that families were receiving powdered formula without being assessed on infant preterm status, whether the infant had an illness, whether the family had access to boiled water. And the health department and the media were requesting formula donations. And again, those are, that's prohibited by IYCFE standards. So out of this experience, we learned a lot of lessons and thought through about some recommendations for the next time. We think it would be great if shelters and evacuation sites add questions related to infant feeding on their intake questionnaires, just so that pregnant and parenting families with children under 2 can be provided the appropriate support and supplies. We would love to also see in every state, teams of emergency infant feeding responders that can report to sheltering sites once they're notified that a family with a child under 2 is in the shelter. And again, those teams would be the ones to perform feeding assessments and provide the appropriate supplies. And then just more generally, following international guidelines for formula distribution and management, designating an agency to lead that would be wonderful. And then making sure that safe feeding supplies are available at all shelter sites. There should be a pre-existing purchase order list that's ready to go when disaster strikes. I mean, diapers, wipes, none of this stuff was available. So there were a few callers to our warm line whose infants hadn't had any formula between 8 hours and 48 hours, one baby in particular, 2 days without any food. So that's not acceptable, so IYCFE really needs to be made a priority when it comes to emergency planning. And then one other thing that came out of this was how valuable it would be to partner with perinatal health professionals in other parts of the country, and to sort of reciprocate services in times of emergency, because in New Orleans, when we're the ones coping, navigating an emergency, it's very hard for our lactation professionals and birth workers to be providing the support when we're trying to take care of our own families as well. So it would be wonderful to just see this web of breastfeeding and birth workers that can help each other in times of emergency. So if, for example, if several members of the Maine State Breastfeeding Coalition could staff, the hotline when we're experiencing a hurricane, or vice versa, when you guys are, I don't know, big snowstorm, I don't, something like that. That reciprocity is so important, and that's just bringing, perinatal health professionals across the country together. So, yeah, and just a shout out to our funders, and yeah, that just about closes out my presentation. I'm happy to answer any questions that you may have.
Yeah, I have a question. Do you have a relationship with a milk donor bank or anything like that? Is that hard to access that resource during emergencies?
Yeah, that's a good question. We don't have a formal relationship. There is one milk donor bank at a local hospital, but I mean, that's a good question. I know particularly for any premature babies, that would be a good resource to tap into. And it's something to think about for the future. I think it's like, until we've kind of been through the scenario where things are just have fallen apart, you don't really think about the different moving pieces, but I appreciate you bringing that up, because that's something I do want to take note of and kind of see where that could go.
Yeah, well, thanks for sharing those. It was really interesting to see the different kits and how, what comes up in emergencies, because we are lucky in Maine. We don't have a lot of natural disaster. We get a lot of power outages. So that's a thing, figuring out how to, deal with frozen milk
Yeah.
and snowstorms.
Mhm. Yeah.
Great question, Amanda. Cynthia Cohen, who is from the Mother's Milk Bank Northeast, who we have a close relationship with, she was hoping to be here for the meeting. She was really bummed she couldn't attend, but she said that this is a topic that is very interesting to her and that they want to be a part of any future efforts that we might be taking as well, or making. Thank you so much. Does anyone else have any other questions?
I do.
Please,
have- that was an excellent presentation. I appreciate it very much. And I love the details that you gave about how you thought about the formula part as well as the breastfeeding part and the lack of assessment. That was really important. So you had mentioned when you help people, you have a resource list, and I'm wondering how much, what kind of resources did you find were you giving people, and where can the rest of us in other parts of the country fill in terms of those resources?
Okay. So, I mean, the primary one was the hotline, because that was 24 hours a day. And, we had that staffed nonstop for 4 weeks. But otherwise it was, numbers to the local hospitals. And this is information we just have in the back of our booklet, and it's Louisiana specific information. I wish I had the booklet with me here, but I don't. But it's basically just tapping into perinatal health support that's local.
Do you feel now that people, is this helping people get more prepared ahead of time? Like maybe there's a little bit more interest in prenatal breastfeeding education, or providers are talking about this a little bit more?
That's the direction we're hoping to go in. We actually just applied for research funding. We're in the process right now of documenting this experience and writing an op-ed about it. But we also are gearing up to do some research, because it raised an interesting question about how to support IYCFE in populations with low breastfeeding rates. Because you can talk breastfeeding as much as you want, but if people aren't doing it, then that's not going to help. And out of that research, we want to show the importance of the state and the city inserting messages about breastfeeding support, promoting breastfeeding as emergency preparedness strategy, so that we can kind of reverse some of these numbers. So yeah, that's the direction we're hoping to go in. And we think people will listen more if we have, numbers to show and the data to show what's wrong right now.
Yeah. You did, it's amazing to me how much you did in a short amount of time. And then you get hit with not one, but two, or maybe.
It was horrible. Yeah, then there was a third one after that. It was just not.
So but you're definitely tried and true. So
okay. Yeah.
That was inspiring.
Thank you so much.
Thank you.
Excellent. Thank you. We are at our time to move into the next section of our meeting. And I think if anyone has any further questions, then please ask when it comes to your time in this next section of the meeting. Thank you again, Malaika.
Yes.
Okay, thank you. Sorry about that before. Thank you so much for making time to come and share that incredible work and experience with us. And I hope you can stay on for a bit to learn a little bit about what's happening in Maine.
Definitely, I'll stay on and listen.
Okay. And what I'm going to do right now is, yes, I see Robin's question. Would you mind typing in your email address, Malaika, into the chat so that people know how to contact you with any further questions. Thanks. And if you're willing to share the presentation for us to include in our notes, then please go ahead and send that to me and we will do that. If that's not okay, we understand as well. We post our minutes on our website too. Okay, thank you for sharing that. And I'm going to share my screen again with the agenda so we can see what this next part of the meeting is. Hopefully you can see that. Just have to get to that part. So this next hour is dedicated toward sharing any new knowledge. And Amanda is going to facilitate this, but I want to start out by sharing something that we might be able to utilize while we are going through this section. Let me just see, I need to share a different screen now, but these are the questions that you can be thinking about when it comes time to share. So let me share a different screen. I can find the right screen. Here we go. Okay, what can you all see now? Amanda, can you tell me what you can see?
Yeah, it's the MSBC new knowledge worth sharing.
All right, so I'm going to have to minimize you all for a second. So this is a Google document that I'm going to drop the link to this document that anyone with the link can view and actually edit. So bear with me as I get back to the meeting here. So I can drop that into the chat box using my other screen. Of course, I can't find my chat box now. There we go. Okay, and it's on the screen, so hold on. All right, so this is a document that I started to fill in when I was going through all of the different research and notes that I was coming across since our last meeting. First, this link here is the MSBC email that was sent out last week and this week with a reminder about our meeting. And also it has a number of different resources for infant feeding in emergencies in Maine. And the USBC has an incredible resource as well. So that's the link to that newsletter. Let me know if for some reason that doesn't work, if you want to see that. I'm happy to go through what I've added in here. It's a lot. I will do that when it comes to my turn. I want to hear from some other people first. But what I want you to know about this document is you can scroll down and you can add to it if you want to. If there's anything you have that you want to add, feel free to click on this document and add that. So, or add whatever you would like. But if you just want to chat too, then you can do that. I can't see anyone anymore and I don't know where you all are. So I just need to figure out where you are. And then I would like to see some faces again. Amanda, I'm going to let you take it from here and go through the list and ask people to share. How does that sound?
Great, that sounds good.
Okay.
So this is the connecting the dots part. It's more networking, sharing what's going on. Some of the things that you could talk about is anything new that's happening in your work or your life around breastfeeding, anything happening legislatively, any new research or any challenges that you want help on. And I can go first, and then if there's anybody that needs to leave the meeting earlier and you want to go now, just let me know. Otherwise, I'm going to go down the list. And if you don't want to share, if you just want to say your name and your organization or what brings you today. And but yeah, I'll just go first. So I'm Amanda Powell, Vice President of the Coalition. And I just have some exciting news because I accepted a new position with Maine Health as the program coordinator for the perinatal substance use disorder program. So I'm very excited to do that. And I'll be working with Caroline Zimmerman. I don't know if, I'm sure a lot of you know, and also Kelly Bowden, so that's exciting. So I start that next week. And then outside of that, I'm a maternal health consultant. So I have a few clients that I help in the maternal health world. And there's a message from Sharon. So if you want to go next, you have the floor. Oh, and you're muted, Sharon. Yep, there you go. Yes.
Okay. Sorry about that. I arrived late to the meeting and I'm going to have to leave early with other things going on here in the hospital. I work at Maine Medical Center as the manager of the lactation and childbirth education program. And a couple of things that I would share with you. We're continuing to offer all of our childbirth education classes for free remotely. That includes the breastfeeding class and the weekly breastfeeding support group, both of which Kara leads. Not exclusively, but she's one of the great instructors and the core facilitator of the breastfeeding group. Other resources, we continue to have lactation outpatient appointments here at the hospital 7 days a week, and the 662-4555 number is how to get a hold of any of our lactation consultants. And the little piece I would share as a helpful resource that we've been discovering and using more of is the website firstdroplets.com. It's sort of the rebranded Jane Morton videos on hand expression and getting started with breastfeeding that are on the Stanford Medical School website, but firstdroplets.com is like a newer graphic feel, a little bit more parent-friendly educational resource with videos. So that's my resource to share. Thank you all. I'm sorry I have to leave early.
Thanks, Sharon. I'm interested if you know if doulas are still going to be allowed in the hospital for the foreseeable future, but I don't know if you want to answer that in this.
As of right now, doulas are still welcome, but the visitor policy changed a couple weeks ago and it could change again. So I don't know the answer to that, but just keep checking the website, the COVID banner on the top, because that's where any of those changes would show up.
Oh, okay, that's good to know. And then Kelly, did you want to go next?
Sure, thanks, Amanda. I let Kara talk about the work that she's doing with perinatal outreach specific to breastfeeding. A couple relatively new things related to perinatal substance use disorder. And I'll put this link in the chat box. The American Academy of Pediatrics released a newly updated statement, a clinical report on neonatal opioid withdrawal syndrome, and really just a updated guidance and policy, and encourage you to go ahead and read that. And then the other bigger news relates to the Office of Child and Family Services, and if the moms who are affected by substance use disorder and their babies, when those babies are born, there's been for about 14, 16 years now, a law mandating a notification to the Office of Child and Family Services, and that's not going away. What's being added is something called a plan of safe care. And that's going to be required starting on January 1st. And the education sessions with the hospitals is starting next week. So you will start hearing the terminology, potentially plan of safe care. And that's really, it's going to start with the families who are substance affected, and then it will expand eventually to all families. And so there'll be much, much more to come on all of that. But if anybody has any questions, I can try and answer them.
I'm just going to add, Kelly, that Ashley Olin, who manages that Plan of Safe Care program, will be speaking at our coalition meeting in June, I believe it is, next year.
Great.
So she'll have a lot more to report at that point too, but thank you for sharing that and letting people know that that's in the works.
So I think that's all I have.
Great, thanks, Kelly. So I'll go down the list, and again, if you don't have anything to share, you could just, say pass or say what your name and organization is. So next we have Allison M. Are you on here? I'm trying to find your picture.
I'm assuming it's me. It's Allison Mark.
Yes. Yep.
Okay. Allison Marcoux. I am a nutrition educator and breastfeeding coordinator for WIC, Maine General WIC, and we serve all of Kennebec and Somerset counties. And I feel like I don't really have anything, updates about us or anything. I think that my one challenge that I thought of today before the meeting, I think I may have brought it up last time, is that, again, I had another mom that had a NICU experience. And by the time I talked with her, she was 20 days postpartum and still using the Initiate program. Did I mention this last time, maybe in October? She was still using the Initiate program on her Symphony at the hospital, and her supply had plummeted. So if anybody has any suggestions or ideas, I know that when we received the cards from Medela, we had labels to put on the pumps, but clearly that is not flagging. That change is really important. And I can only imagine being a mom with a baby in the NICU, how overwhelming that is. So I'm sure the information's being given, but it's being missed. And if it wasn't happening so regularly, then I would say, it was just because things were hectic or whatever. But it can't. It has. I mean, that's just in our agency, and we see it quite often. So any suggestions are very welcome.
Thanks for sharing that again, Allison. I took that feedback last time and put on my other hat as the breastfeeding consultant for the perinatal outreach program. And in the newsletter that I put out, I did include that some information about that. And I'm sharing my screen now to show you that part. Medela has some really great information on their website, excellent education. And I'm not sure if this went to whoever it may have needed to go to, of course, but if you receive this newsletter and you think there's someone who might benefit from seeing it, please pass it on. And if you don't receive this newsletter, please email me or Kelly, and we can add you to that listserv. And yeah, so there was an effort to put some education out there, but I know that it's not always going to the right folks, or we also never always know the full story with how that education is given or received. But thank you for sharing that.
Thanks. Next is C. Gooding. C. Godding. I'm not sure if that.
Hi, it's Cindy Godding.
Okay, great.
So I'm from WMCA WIC in Franklin, Oxford, and Androscoggin County, and I'm the breastfeeding coordinator. We are still looking for a breastfeeding peer counselor for our Auburn area participants. So if you know of anyone who has participated in WIC and has had at least 6 months of breastfeeding experience, we would love to talk to them about supporting other breastfeeding moms. And also, I will be leaving WMCA as the breastfeeding coordinator and going to work for Maine General WIC program in the next month. So Amanda Rosignol has not been officially named, I don't think, but I think she's probably going to be stepping into my position because she's the other IBCLC on staff. So I'm excited about my new position, and Amanda's going to do great as a breastfeeding coordinator. Again, I don't think that's officially been said, but I'm assuming.
Great, thank you. So next is Cheryl Bean Moody. Are you there, Cheryl? Okay, well, just let us, if you come back, we can do that. And then next is Donna. Did you have anything to share, Donna?
As in Donna Ellis?
Yes, sorry.
Okay. Just that I'm Donna Ellis. I am the secretary for the Maine State Breastfeeding Coalition. I also work with Healthy Children out of Cape Cod. And I am an IBCLC and an ANLC as well as a registered nurse. But I don't have anything new going on at this point in time. Thanks.
Next we have Heather. There's no last name on that one.
Okay, can you hear me okay with the mask?
Yep, that's good. Yeah, thanks.
I don't have anything new to share. I took care of a sick grandmother, quit my job as a IBCLC, and now working as a COVID tech. So yeah, I'm just kind of doing the kid thing right now again.
Well, thank you for.
I'm trying to get back. I want to get back eventually into IBCLC and just trying to keep up with everything that's going on in the state so far. So
Yeah, well, thanks for being here today. That's, I mean, it sounds
absolutely.
like you have a lot going on. Thanks for doing the COVID work.
Yes, absolutely.
Next we have Holly M.
Hi, everyone. Hi. So just a few updates for all of you. Just wanted to let everybody know that obviously I am not making my trips up, to Maine at this current time without, the clinicians specifically asking me to come up. I have come up a few times, for meetings with, clinical managers at offices and that sort of thing, but really not up in Maine as I had shared with you guys earlier. I've mostly been communicating with the offices, the hospitals, WIC, and other organizations, some of your family health centers, via the phone, Zoom, and emails. The nice thing here is that, I've been supporting all of you for many years now. So I am very confident in knowing that if organizations need something or they have a question about something, whether it's insurance or the different pumps, whatever it may be, that most of the state is very comfortable with either calling me or emailing me. So that's kind of how I've been working things over the past few months. The one big update that I wanted to share with all of you is that Jason and I have really been still working closely, with Maine Care. We feel that we have a really good rapport with them. And so over the past few months, we have been sharing with them the importance of covering milk storage bags for our moms on Maine Care, and that was approved. So we feel very grateful for that. With that being said, we have developed a new maternity order form that I am slowly distributing out to the offices and the hospitals and the other organizations. It not only has the breast pump order form, area prescription to it that you are all used to, but it also includes the milk storage bags. So what I have been sharing, with the clinicians is that if a provider orders a breast pump for a mom, if she has Maine Care and the provider would like her to have the milk storage bags, there's right under the breast pump, there's the milk storage bag information that they just have to check off. It's very self-explanatory. And Kara, I'm happy to send you a PDF of that, just so everyone can be aware of what I'm talking about if you haven't seen it. But moving forward, that is probably what I will be using for the new order forms, unless I hear from you that, you know what, Holly, we've been doing the order form that we've been using for the past, 5 years, and we want to continue to do that. So again, like always, everybody, I'm very flexible with whatever is going to work for all of you. We also had quite a few requests and conversations from clinicians and providers regarding home blood pressure monitors, because women, some areas of Maine are seeing patients and others are not. And so we wanted to make sure that the providers had access and a home base to obtain a blood pressure monitor for at-risk prenatal moms, as well as the moms that are leaving the hospital or during that postpartum period. So as of December 1st, I am happy to share with you that Maine Care has approved those as well. So, trying to get that information out there. I've been working social media regarding, email blasts and that sort of thing to all of my contacts in Maine. So that is the two big things. And so the blood pressure monitors are also on that new maternity form as well. And then let's see, what else? We talked about that. We talked a lot about Maine Care. Nothing has really changed with them other than this progression of these two new products, important products. But the one thing that I just want to share with all of you is that we really have revamped the website, the Acceleron.com website. And for all of you, one of the tools that we're getting a lot of positive feedback in is the Acceleron. If you go to Acceleron.com/lookup, and I can share this with you, Kara, as well. If you go on to that, all you'll need to do is type in, it prompts you to type in, and the mom can do this as well, the mother's insurance, the state would be Maine, and then it will just come up with all the pumps that are fully covered by her insurance. So whether that's a commercial or regional insurance, or whether that is Maine Care. If it is a commercial and regional insurance, we will show her all of the pumps that are 100% covered by that insurance. And then also the second half of the screen will be any upgrade that the mom can do if she chooses, as well as what the pricing would be for that mom out of pocket. Of course, that would not be applicable for our Maine Care mamas, okay? I have had a few of you call recently in situations, and I have been so grateful to the Acceleron team for helping with this. I've had a few calls of those families that the moms just do not have health insurance, and the pump and supplies are billed through the mom's insurance, not the baby. So if we have some moms and refugees that come, the baby is covered, but the mom is not. So please, if you run into a situation like that in any of your areas throughout Maine, please reach out to me personally via a phone call or an email, because we tend to have some pumps in our free care closet. They could be returned. They're not open. The box may be damaged. And so we try to keep a bunch of those pumps down in North Andover for situations like that. Lindsay had a situation where she was such an advocate for this mom, and we were able to provide her a breast pump, and she wouldn't have out of pocket, and she just didn't have insurance. And so please just keep that in mind too. If there's anything that you need to let me know, and I can work on my end to get that done for you. And then lastly, I know there's a lot of my WIC friends here, and I certainly have been in touch with Donna DeMarsh, and I just wanted to let all of the WIC folks know that there are, you'll see on the website, there are some, new pumps, insurances change. So we have to change regarding reimbursements and all of that. And so for New Hampshire, I've just been reaching out and scheduling some Zoom meetings and in-services via, Zoom. And so if any of you would like me to do that, it would just be like, one time I remember a few years ago, I came up to Allison's house and we just kind of played with the pumps and had a great time. So I can certainly, I would want to go through Donna for all of that. But if that is something that she, would want to happen, I'm more than willing to do that as well. We would just have to do it, virtually. So that's all I have, Kara. I didn't know if anybody had any other questions. You all know how to get a hold of me if you need anything. And like I said, I hope that I can get up there at some point. Robin, you're on mute, but did you?
I don't actually know how to reach you other than through the Aceleron website.
Oh, okay. Okay. Kara, do you want me to just?
You can just put it in the chat and I can copy it.
Okay. Okay, perfect, Robin. I will do that. Absolutely.
Great. Thanks, Holly.
You're welcome.
I put your website and the /lookup when you were explaining that in the chat box. And I also put it on that Google Doc that I was telling everyone about, where I'm trying to keep some of these resources listed.
Sure.
Sure.
Perfect.
So, great. And then one question, Holly, you had mentioned that new mom form. Do you, and yeah, please send that to me. Is there a web link with that PDF that we could put in the chat box or put in that resource? Is that anything?
Yeah, I can send you all of that. Yeah, I'll just send you, Kara, anything kind of new, and then you can look through it and then, send it out or place that in a home that will be best for the coalition and all of the, the members and the clinicians throughout the state.
Excellent.
Yeah.
Thank you so much.
You're
so many great
welcome.
updates. I'm so glad you were here to share that.
Yeah, thanks for having me.
Holly, is there any changes with the Pump at Work program, or is that on pause because most people are working from home?
It's still available. But, we were all talking that we may in fact need to change and adapt that a little bit, with the way things are going. And so we are willing to do that, and change and adapt as we need to. The other thing that I didn't mention, Amanda, that I wanted to, and I'm glad that you brought that up, is that we are still doing the monthly webinars for the moms. So, any mom that wants to gain information, sort of what I did for the coalition this summer. Brittany is doing that. Her and I share that. Brittany has mostly been doing that. She's a CLC and I'm a breastfeeding mama. And so that's been really well attended lately. So that's great. So I can send you that information as well, Kara and Amanda's, for you to share, but that is still, available.
Great. Thank you.
Yeah, you're welcome.
So next, Donna DeMarsh, do you have anything to share today?
You're on mute in case you're okay.
Sorry, guys. I'm having some problems with my connectivity today. Holly, I apologize. I missed most of your presentation, but we can connect later.
Absolutely, Donna. Sure. Yep.
Yes.
Absolutely.
So the WIC program, I think I mentioned last time that our EBT cards are underway. And now I believe everybody who's on WIC in the state of Maine has a card now. In the programs, it's going really well. Yeah, everybody, thank you, Amanda. Yeah, everybody's pretty excited. We have a couple old school people that aren't so excited about it. They want the checks back, but majority rules. So we're sticking with the cards, but going really well. Still trying to, a lot of our clinics are still doing remote appointments. And so that poses some challenges, but I think everybody has that under wraps right now. So everybody's doing well with that. And that's about all I have to share for today.
So Donna, do those cards expire like a normal debit card, or do they have an expiration date?
The card itself does not. So we load the benefits on 3 months at a time, and people can use their benefits monthly. So they still get the same amount of benefits per 30-day period, but it just automatically kind of renews the next month. And if they didn't use things, that it does not carry over. But the card itself does not expire unless somebody loses it or it gets stolen or something like that. Then we deactivate it and give them a new one.
Okay, great, thanks.
You're welcome.
Next we have Jenna Norton.
And I also just want to make sure that when you have your turn to fully introduce yourself too. So your name and where you're from and what organization you're representing.
Okay, I'm sorry, I always forget to unmute myself. A lot of things are going on right now. I have been homebound since Wednesday because I was close in contact with a coworker that is COVID positive, so I've been working from home. Just quick test results and it's negative, so yay. I'll just introduce myself. Jenna Norton. I work at Aroostook County Action Program. I have a lot of hats, but for the purpose of this meeting, I'm a breastfeeding coordinator for WIC, CLC, and that's really it. I'm under a different building location with the WIC girls, so I don't see them as much. So that's been a little bit of a a challenge not being with them all the time. But yes, I think I said everything I was supposed to say. So.
Great, thanks. I'm sorry you have to quarantine, but glad you got a negative test.
Oh, yep.
Jennifer Vigor.
Hello, Jen Vigier, York County Community Action WIC Program, Biddeford, or the breastfeeding coordinator for York County Community Action. We have done the rollover, like Donna has said, with our last 3 months of participants. Now, so all of our participants have the cards. The only ones that don't are people that are going to be re-enrolling, and some of that we're doing that part of it we're doing in person. A lot of the appointments are remote at this point. Our Biddeford office will be moving. We're moving to Elm Street, so we're still staying in Biddeford. We're just moving closer to 5 Points, that area right there. So we should be moving this month sometime. So it's been interesting packing and getting rid of stuff and all that stuff, because we've been here for, I want to say 9 years. So downsizing and all that other stuff. But as far as everything else goes, pretty similar to what Donna said. People are liking the cards. Some are re-enrolling because of the cards. So things are going pretty well.
Great, thank you. Lindsay Mitsopoulos.
Hi, I'm Lindsay Mitsopoulos. I'm the breastfeeding coordinator for the WIC program covering Cumberland County. Same as what everybody else from WIC has been saying, our rollover to EBT is going well. And we have a new breastfeeding peer counselor that's training with us right now. Her name is Eliane Mbole. Francine gave her notice because she was working 2 jobs and it was just a little too much. So bittersweet to lose her, but we do have a new breastfeeding peer counselor who's in training right now and should be on her own in just a couple of weeks. So yeah, things are going well here.
Thank you. Mary Block.
Hi there, I'm Mary Block, and I am a longtime La Leche League leader and an IBCLC, and I've been working up at Maine General for the last month on their maternity and pediatric floor, which I'm very excited about and a little overwhelmed and in a growth mindset but just delighted to be working with breastfeeding families at Maine General at a baby-friendly hospital. And let's see, I would just want to add that La Leche League of Maine and New Hampshire is holding 2 weekly meetings via Zoom Tuesday mornings and Tuesday evenings and Friday mornings. And Maine General is not holding any breastfeeding support group meetings in person or on Zoom at this time. And just as of, Tuesday, we went back to 1 support person per mother when they are admitted. So COVID numbers are on the rise up at Maine General, but so just delighted to be here. And I want to attend as much as I can just to stay in touch with the breastfeeding community. So thank you so much.
Thanks.
I'm glad you're here, Mary, and congrats on the job. I'm going to put the Leachy League's website in the chat box too for people to see that info.
Yeah, are you working with Paula Norcott?
I am. I'm working with Paula and Chelsea and some other great folks up there. Yes, yes. It's just a pleasure to work with them. Yes.
Great. So Nicole Hart.
Hi everyone. I'm Nicole Hart. I am a CLC and postpartum doula in South Portland. I don't have a lot new to share. Maine Mother and Company in Brunswick, for whom I facilitate groups, is still doing virtual groups on Monday mornings at 10 a.m. We haven't seen a lot of people. A lot of people have gotten one-on-one virtual doula visits with me, which is great for them, but maybe not what they were looking for. So if you know of any parents who could benefit from some connection and support, that is available. I see Kara just put the website. And then Paula Norcott and I, through Maine Mother, are offering lactation support, virtual and limited in-home lactation support for now. I'm not sure. We don't have like an official like case rate where we would stop doing that. So it's kind of a case by case basis, but it is something we're offering right now. If any parents you work with could benefit from having someone come to them. That's it.
Thank you. And then Rihanna Plord.
Hi, my name is Rihanna Plord. I am the breastfeeding coordinator and also a dietitian for the WIC program in the Penobscot and Piscataquis counties. So a few updates here. We've been, teetering with, the COVID rises and everything. We were doing in person, and now are strictly doing mostly remote, some in person. So that kind of changes up how we can provide breastfeeding support, because we were actually able to do some in-person, like socially distanced breastfeeding support when we could do mostly in person. But I also just passed my CLC, so I'm wicked excited about that. Now we have a full staff here at Bangor who are all CLC certified. So we have 8 on staff. So I think that's incredible. We're really able to, meet the needs of our clients for sure. And then for a couple other updates, we just got an Instagram. We're trying to branch out into the social media world. I'll put my Instagram handle. I run the page, and I really try to put on nutrition and because we're a nutrition program and breastfeeding education. So I've actually used formatting from TikTok. If you guys are all familiar with that, it's a new platform. I used the editing features for that, and I was able to make some videos regarding some of the breastfeeding products we give out, like the silicone milk collector, the manual hand pump. That way clients can reference those videos if they want to know different ways to use them or how to assemble them for cleaning and all of that. So I'll put that Instagram handle on there. We also have a Facebook, but that's through the Bangor Public Health and Community Service. So we all share it, but we're still posting on there too. So if anyone has a platform, like a social media platform and wants to share ours, that'd be great. We're trying to really expand out there. And then lastly, we just initiated the Buddy program, which is actually a USDA WIC program. And we just initiated, it's for pregnant and breastfeeding moms. That's who the target population is. So basically they have an application they can fill out. We put it in our new pregnancy packets when we mail those out or give them to new pregnant moms. So basically it's going to be led by our breastfeeding peer counselor. She is going to get applications from anyone who's interested, and they basically get paired up by similarities. So their weeks of gestation, if they're currently breastfeeding, if they're currently breastfeeding and formula feeding. That way they can kind of have that support and they can share their experiences like mom to mom. It almost just adds another layer of support besides our breastfeeding peer counselor. Kind of just expands that kind of their group basically, especially during these hard times with COVID and the wintry, seasonal depression coming up around the corner. We're really excited that we've launched this out, and we hope we're going to try to assess the success rates a few months down the road, but we're excited about it. And that's all I have.
Great, thanks. I love that you're using the TikTok video Instagram thing. That's fun.
Yeah.
Robin, would you like to go next?
Hi.
There you are, yes.
My name is Robin Snyder Drummond, and I'm an IBCLC. I'm in the Hancock County, Ellsworth area. I'm finishing up the training with Michelle Emanuel for the tummy time method. Are you familiar with that at all? Well, okay, it's excellent. I've been wanting to do it for about 3 years, and last year I was all signed up to go to Toronto for the training, and then COVID hit. So I'm doing it online, and I'll be done in about 2 weeks. It's specific therapeutic exercises to help babies with their alignment and their neurodevelopment. But I don't use all those big words. It's a wonderful way for parents to connect with their child, to gain confidence and learn the baby's cues, and to help them like just get their own body aligned, the baby's body aligned. Non-judgmental. I saw it being very helpful for babies who had torticollis or tongue ties, and sometimes it would just help release these muscles, and then they didn't need a frenotomy. They just they had some tightness here from labor or whatever. So it's very proactive, very productive, and very parent oriented. When I finish my training, I'll need to do some groups or individual ones, and I'll be doing them virtually. I'll put this on my website. My website is birthready.com. I'm doing phone consults. I was doing private practice lactation consults, video, and it just got to be too awkward. So I'm focusing on the tummy time method, and I'll put that on my website. So you can just contact me, birthready.com. If you have any questions, I'll keep posting. I have a blog, so I write about this stuff. Anyhow, do you have any questions now? No.
Okay. That sounds great.
Yeah, I've been wanting to do this for like 3 years because I saw what a huge difference. And even just little things like this, mom was doing fine. We got past the first things about latching and supply, and all that was fine. But then the baby wouldn't poop, and she's so worried about that. We just did a few little exercises, and the baby pooped 3 diapers. It was great. I mean, these are the things that make me happy.
Yeah, no, that's incredibly empowering for the parents when they can do something that helps. That's so powerful.
Yeah, it's teaching parents. I'm not doing it. I'm teaching them. And then they learn these specific a sequence of 8 exercises. And then, we meet a couple times to talk about it. It's really nice if we can do it as a group, because then you collaborate and you meet other people. So I'm going to see how that goes virtually, but I feel that's the way to do. I'm really not comfortable with doing home visits with teeny little babies. I volunteer and deliver meals to new moms, but I'm keeping a distance from little babies. So much as I love them, I'm good. So,
Robin, can you put your website in the chat box and your full name, if possible, for Donna to type up?
I'll put it in the type box or chat box right now. Great. Thank you.
And osteopathic work is pretty common in Southern Maine anyway. With UNE being here, a lot of babies are referred to DOs who specialize in osteopathic work for babies for breastfeeding issues. And most every time I hear a mom who has seen a DO for that reason, they say, okay, we have to do tummy time. Like that's what the doctor has recommended. You know, the doctor will do whatever adjustments they can do, but then the homework for the mom is to do tummy time. And so that's so great to have more resources and learning opportunities through people like you and groups.
I also feel like to work with the chiropractors or DOs or massage therapists or just something like even just an IBCLC, and then you leave and then parents have something to do 3, 4, 5 times a day, and then we check in and hey, it's working. So it's always that easy. Yes. Okay, I just put it in the box, so we're all set. Thank you.
Thank you. There are 2 people on phone numbers. I don't know if that's connected to any of the videos or if you're on a phone number and you wanted to speak up right now. Okay, well, I have one other thing to add and then Kara can go. In my consulting work, I learned about this week, and I think it was in Kara's Google Drive link, but and it's maternal health related. I know I'm maternal health heavy, but it's all related to breastfeeding, we know. So the Department of Health and Human Services is, with the Surgeon General, is releasing a call to action. And it's really exciting because they want to, by 2025, they want to reduce the maternal mortality by 50%, C-section rates by 25%, and try to get a better hold of high blood pressure in maternal health, which my last 3 clients had hypertension in their pregnancy. I don't know if it's a pandemic thing or what's going on, but definitely a problem. So that they're having a webinar about that right after this from 3 to 4 with the Surgeon General and Health and Human Services. So I can put that, the registration in the link if anybody wants to join that. But I thought it was pretty exciting goals that they have. So I think I got everybody except Kara, if you want to go next.
All right, I see I'm not muted already. Okay, I'm gonna go ahead and share that screen again. And I have it right on what you were just talking about, Amanda. So I just have to move you all out of the way for a second. Right, so I just heard about this morning as well, and I'm planning on doing that 3 o'clock webinar to learn more. Those are the 3 of the action plan items that you were just talking about, and that's exciting. And Kelly Bowden had sent me the information about this, and she mentioned breastfeeding, though what she had emailed me didn't have anything about breastfeeding. So I was like, I wonder if they included anything, but yes, of course they did. It's further in that action plan, and breastfeeding is mentioned a bunch of times. So I look forward to learning more about that and seeing what the Breastfeeding Coalition can do. And if this might mean more grants available for work. I think they are focusing on disparities as well, which is something that we want to be looking at, of course. So that is exciting. And again, bear with me as I just adjust the camera so I can see my scroll bar. So, and also let me just share a link to this document again, so you are all welcome to you are all welcome to add to it or review it as we go. I just have to get back to the chat box. Which, okay.
Want me to put it in there?
I got it. Here we go. And so you are welcome to add to this at any time. We might find some way to make this available on our website. We'll see. So I mentioned that email that has infant feeding emergency resources. Someone had sent this Care for Breastfeeding Women. I think it was Sarah Gabrielson, actually, who wasn't able to make it today. That has some updates, some research on how breastfeeding has changed in the hospital since COVID. It's just sharing also the research that breast milk is not a likely source for coronavirus transmission, and that there's new evidence that it is inactivated during pasteurization, and that we always need to be considering infection prevention measures and for lactation measures. Okay, sorry, so that was different. Those are just the latest updates on breastfeeding with coronavirus. This next one is about how additional post-discharge breastfeeding support and newborn follow-up might be needed during this pandemic. That probably seems obvious for all of us who are working with moms and babies. Longer-term monitoring of exclusive breastfeeding rates at hospital discharge will be important for assessing this aspect of the pandemic on infant health. And to start out, because of the pandemic, they found that almost 18% of hospitals reported that in-person lactation support had decreased, and about 73% reported discharging mothers and their babies early, so less than 48 hours of birth. And therefore, post-discharge breastfeeding support is going to be especially helpful. Another study that just came out showed that breastfeeding and infections in early childhood, that the increased duration of breastfeeding, especially exclusive breastfeeding, protects against infections requiring hospitalization in the first year of life, but not hospitalizations or symptoms of infection at home beyond the first year. But that's huge. Like, these are all research articles that if you're ever trying to write some sort of grant or proposal for more support in some way, or why to allow for more breastfeeding support, research like this is really helpful. Also finding that weaning occurs earlier for infants with in-hospital formula feeding. It's a 2.5-fold increased hazard of weaning found after adjustment for medical indications of supplementation. This is probably also not surprising for those of us who work with families either in the hospital or after the hospital setting. And this is almost exactly what I found in research that I did at Maine Med about 7 or 8 years ago, finding a 2.5-fold increase when supplementation was given, or if a doctor recommended giving supplementation of early weaning. And also finding exclusive breastfeeding results in drastic reduction of pediatric dental disease. And so this is really interesting because I don't know if any of you remember, we've had previous presentations about oral health programs in Maine and specific to breastfeeding. You may have heard before that there have been some concerns shared before that breast milk has sugars in it, and so it can potentially cause cavities in babies. So there have been concerns about that. So this is really good to see that there's some good research showing the reduction in pediatric dental disease. And newborn feeding recommendations and practices increase the risk of development of overweight and obesity. This is specific to feeding formula on the first day of life. Infants overfed on day of life 1 were significantly more likely to be overweight or obese at their 4th year compared to infants not overfed. And again, I believe this is related to volumes of formula during that first day. So also good research. I found out that the MSBC conference will be happening next June. It will be happening virtually. And so it's still certainly worth checking out. LactEd is a really great resource. They have lots of good educational opportunities that are affordable for providers specifically. So if you work with any doctors who you think could use some more breastfeeding education, this is a really great resource. And it's a nonprofit organization run by an MD herself. Carolina Global Breastfeeding Institute, there's someone who's supposed to be here today who just moved up from North Carolina to Maine, and she still works for the Carolina Global Breastfeeding Institute. Amazing program. Their Ready Set Baby program is awesome. National WIC Association just launched a webpage titled WIC and Health Resources for Native Peoples in celebration of Native American Heritage Month. So that's good to look at. If anyone on this call works with Native populations in Maine, please type something in the chat box, or when I'm done talking, which will be very soon, you can speak up and share a bit about that, or share some where you think the Breastfeeding Coalition in particular might be able to help connect with those populations. And we did reach out to some different groups during World Breastfeeding Week and the weeks after, when there was a Native Breastfeeding Week. But we would love to have some more connections there. This is what Amanda was talking about. It has the actual action plan linked in there. This is really exciting. And And then if you want to register for that webinar that starts in 16 minutes, you can click on that link in this document. If 2 hours isn't a long enough time to be on Zoom. And then they also have some really great information about programs that you may already know about or want to know more about. Let's see. And then the perinatal outreach. So Kelly had mentioned that I would share more about this. So one of my other hats is as the breastfeeding consultant for perinatal outreach. And one of the goals in the work plan is to increase prenatal education. So I will be doing webinars for providers, basically, or for any of you who are interested, anyone who provides prenatal education. I will be doing a webinar January 6th, or it's a little blurry, from 12 to 1, I'll be talking about conversational approaches to essential topics around breastfeeding. So what is really important to teach families during their pregnancy about breastfeeding, and why is this so important? There's just so much research showing why prenatal breastfeeding education is where it's at. And also just sharing as many resources as I can for people to use in their education. So you can register for that still, and you can share that around. And let's see, and then these were all resources that were talked about during the meeting that I typed in while I could. So again, feel free to add to that, and this might be something that we do more going forward. Oh, and one other thing is that I'm part of the Paid Leave Coalition of Maine, and there is some good work being done here. Oh, two things actually, legislative wise. That bill was never passed last year. Basically, a lot of things just died in the legislature in Maine this year, and so they have to be put forth again. The paid leave bill, LD 1480, something like that, will need to be put forward again. They're talking about putting a commission together that would evaluate the best kind of a program. So there is work being done. If you're interested in being part of the Paid Leave Coalition, there's the legislative side of it, and then there's the community side of it. Building awareness around it, then please let me know. Send me a message. I will put my email address in there, but you can always email mainebreastfeeds@gmail.com. And I'm happy to invite you to those meetings. And then the other legislative piece related to breastfeeding is the donor breast milk reimbursement bill that had essentially passed last year, but it didn't get to the final stage. So that needs to be put forward again as well. And I reached out to the sponsor of that, Margaret Craven, Representative Margaret Craven, and she is ready to go to just put that forward again. I'm not sure if we want to look at it again to see if anything might want to change. It's essentially modeled after what other states have done. But so I think it could be ready to be put forward again. So you'll be hearing us update you more about that as we know more too.
I have a question. That seemed like the donor milk bill seemed to go really well. Do we have to start all the way from square one?
As far as I understand. Yeah.
Oh, well, it went really well the first time.
Yeah, it was great. I know it's discouraging. The timing of that, I think that was in January or February too. And then we know what happened
after. It was before the COVID. Oh well. Yeah, okay, we're ready.
Yeah. Brooke Barron, some of you may recognize her name. She has been on the board, Maine State Breastfeeding Coalition board. Gosh, I think she came on in January actually, but she works for the Speaker of the House, and she is right now on Biden's transition team, which is very exciting for her. She wasn't able to make it today because she's very busy with that, but she is our awesome advocacy and legislative resource. So she's going to help guide us through those next steps as well. It's really great to have someone who is in the know there. Robin, I see you added a comment about dental health being a topic and you wrote about it in your blog. Very cool. I think that's it for me. Thank you.
Great.
I'll put my email in the chat box too. Personal.
Do you want me to do the next part also, Kara, or are you gonna wrap it up?
Go for it. Thank you.
Okay. So that's great. We can just go around and say what your takeaways are from the meeting, and then we'll go over the next meetings. I can go first. So I love the presentation because there was so much to learn about. I feel like we're very fortunate in Maine with natural disasters. And so it's just good to know where people are coming from in that and if we ever need that. So yeah, thanks for organizing that, Kara. And Kara, do you want to go next?
Sure. I'm unmuted still. Okay. Yeah, and I will also copy and paste the resources I put in that email. I'll put directly into that document too, if that's easier for anyone. But we had hoped to have someone from Maine speak about infant emergencies in Maine or family emergencies in Maine. And we had a really hard time finding that. Plus they're busy, as you might imagine. So, but they sent some good resources, and the state of Maine does have some good resources, including what people should have in their own packs. Those really inspiring to hear about the Infant Ready program, and maybe that's something we would consider doing. And any of you who think that might be useful, or if there are any ways you think that the coalition could be useful in infant emergencies, then please let us know. Share your ideas. We always want some new ideas. So yeah, that was really great to hear about. And I always love seeing the number of people join in our meetings and discussions and hearing all the great work that's happening. So I'm thankful for all of you.
Yeah, it's great to remember that there's still people outside my house. Holly, do you want to go next? Is your takeaway from today?
Sure. I am just so grateful, everybody, to be here and be invited to this by Amanda and Kara. I definitely think that I can take all of this information as I attend these coalition meetings to really best support you guys, in my role with Acceleron. So it's very helpful to be aware of what is going on in Maine, and be able to, adjust and adapt. Maine and New Hampshire, we're sister states, so we're very similar for what I do here with my coalition and what you all do. So, but it's just, it's wonderful. And it's so helpful for me to really support all of you throughout the state and your breastfeeding families throughout Maine. So thank you.
Yeah, thank you. We love your breast pump knowledge and Acceleron in general.
Thank you.
Cindy?
I think just even connecting with all the different resources is helpful, and going through to add to my toolbox of what I can use with participants or even with sharing with other staff members. So thank you.
Thank you. And Donna, our amazing minute taker. Do you have some takeaways?
Yeah, I'm just, again, like Kara, so grateful for all the many individuals out here who are supporting families as they increase their family size and as they breastfeed. So yeah, you've kept me very busy writing. Thank you.
Thanks. Jenna?
There we go. Okay. I had to reach there. Yeah, gosh, where to begin? This has been very helpful. I'm very happy I'm been finally able to get, make the time to be able to be here for a meeting. I feel like the crazy work schedules lately, I've been missing you guys. So so it's been very helpful with just learning, the different resources and what everyone's been doing. I think sometimes especially me, I get in a rut almost, and just kind of just don't know what I could do differently or new. So this has been very helpful, and I really appreciate you guys. Thank you.
Thank you. Jennifer?
I'm sorry, did you say Jen?
Yes.
Oh, hey, so I'm taking away that Google document that was just loaded and all of those resources. I think it's a great spot to have one location for all of the resources. That's awesome. And then also the presentation was great. It was interesting seeing those buckets that they made and what options they had available to them.
Lindsay?
Did you say Lindsay?
Yes, sorry.
Hi. I love the presentation, and I was also really excited to hear the news that Holly shared that Maine Care is going to be covering breast milk storage bags and the blood pressure monitors at home. I think that's awesome. So really excited to see that go through.
Yeah, that is great news. And Nicole?
Yeah, my takeaway, I love the resource sheet. I don't know if Kara put it together, Amanda, which one of you? It's really, really great. Super, super helpful. And yeah, like everyone else, I just really enjoyed the presentation and learning more about something that I frankly haven't given a lot of thought to at all. So I learned a lot, and I don't know, it was just super interesting. Yeah.
Okay, and then Rihanna?
Hi. I really enjoy all the different topics for the presentations. It's really helpful to learn something new, and I really enjoyed it today. Also, I like the research that's being shared. Being fresh out of grad school, I loved research, and sometimes I don't find myself having a lot of time to do that research about breastfeeding, so it's really helpful to get all those articles so I can browse through those and I don't have to go digging. So that's really helpful for me. But no, I enjoyed the meeting once again.
When I can't remember if you came to ones in person, but we do like an hour lunch before, and then we do a deeper dive where we can talk deeper into research or certain topics. So yeah, Kara does a lot of good work with compiling that research.
It's very helpful.
Yeah. And Robin?
I really appreciated the step-by-step development of that infant and young child feeding program, and then what they learned from it, and how we can also learn from their experience. And I'm impressed with all that WIC in Maine is offering to families around here. So thank you for having these meetings.
Robin, and congrats on your new education with the tummy time.
Oh, thank you.
Okay, was there anyone else? I think I got everyone.
I know.
Okay.
Is there someone on the phone that we have one phone call person on the phone that I don't know if you're able to unmute or you want to.
Do you want to share the screen again, Kara, for the upcoming meetings?
Right, so this is what we have coming up the next few months. Hopefully I shared the right screen. I think I did. In February, Donna is going to be giving us more solid updates from WIC and Donna DeMarche. So looking forward to that. In April, that is when our annual meeting is, and we are going to have, it's going to be like a two-part meeting. The first part is going to be updates from the coalition. Like I said, we're really going to jump into sharing what our strategic plan looks like. And then the second part is going to be a community breastfeeding discussion around that. So what ideas do you have? How would you like to help? What do you know about that's already happening that we can help support? Or what ideas do you have for more specific actions and action plans? And how would you like to help and participate? And in June, like I mentioned, Ashley Olin will be talking about substance use and breastfeeding, specifically the Maine maternal opioid model plan of care process. August is World Breastfeeding Week. So if we can pull together what we did this past year or something similar with all of the educational opportunities to the webinars, and then we will do that again. So that was really awesome this year. October 7th, we will be having an advocacy one-on-one meeting. We've done this in the past. Some of you may have participated in that, but where we learned about what does it mean to be a breastfeeding advocate? How can you be a breastfeeding advocate under your work role as well? I know that WIC might have some limitations on what they can do. So being really clear on how you can still be an advocate in terms of legislation. and understanding what the process of making a bill is and like what happens in this situation when we have to put it forward again. It's complicated. There's a lot to learn. And so Brooke said that she'd be willing to participate in that and also have another speaker who would be appropriate to speak with her. And for December, birth and breastfeeding. I think that's such a huge topic. And Paula Norcott, who we've named a couple of times already today, she is a really wonderful birth doula advocate. She is a CLC right now, but I imagine we'll be finding out in a couple of weeks that she's an IBCLC since she took her exam. And so that is exciting. So it's kind of nice to know what's coming up ahead, though we know that there are always going to be more topics that we're like, oh, this would be a good topic. This would be a good topic. So we'll see if we can squeeze in other information at other times. And please feel free to let us know if there's a topic that you're really wanting to learn more about, and then we'll do whatever we can to get that information to you. And we're constantly updating our website too. So as I often say, if you have any feedback on what you would like to see more of on the website, what you would like to see less of on the website, or any of that feedback is always welcome. So emailing my personal email that I put up there, or mainbreastfeeds@gmail.com, will get to me and Amanda and the board, and we'll continue to talk about it. So that's what's coming up. And I think that was all we had to review. We don't really have any events coming up, though. Cheryl Bean Moody had typed in the chat box when she was introducing herself. Let me just stop sharing that screen. She had typed in about the Best Breastfeeding Conference, and that is still scheduled for next May, and they're deciding what the format is going to be for that, if it would be in person or not. And I remember her messages in March when COVID was starting. She's like, should we do the conference in person or not? Should we do Zoom? And obviously that happened. And hopefully many of you were able to check out those recordings. So that's something will be happening there with that in the spring, but there are no other events that I'm aware of that we are participating in at the moment, but that could change. So thank you everyone for participating, taking 2 hours out of your day to join and continue the good work and continue sharing where you're at and what you're doing. Have an awesome rest of your day, and until we see you again. Bye, everyone.
Hi, guys.